America's healthcare system faces a dangerous and costly crisis. Too many patients are readmitted to the hospital shortly after discharge due to poor care transitions.
In our healthcare system, we have a very serious problem with care transitions, and the problem is that results in avoidable rehospitalizations. Basically, what's going on is people get sick, they come to the hospital, and then they're well enough to go home. But because there's not good transitions and coordination of care, they end up getting readmitted for the same condition that brought them in the hospital in the first place.
We have a healthcare system that remains fragmented. Hospitals don't necessarily talk to physician offices, don't necessarily talk to post-acute care providers like nursing homes. This has created the challenge that care in our country is not well coordinated.
And we know that readmissions is a marker of poor quality care, especially for the most vulnerable in our society, racial and ethnic minorities, the poor, the elderly. And the tragedy of that is that it dramatically prolongs the recovery time for patients. It adversely affects their families and their caregivers, and it costs our healthcare system billions of dollars.
What's clear to experts is that this is not just a hospital problem. Stakeholders inside and outside the hospital must work together and with patients to reduce the problem.
Healthcare is really in a crisis, and it isn't enough just to do a good job in your little office and not look at the system as a whole.
The Affordable Care Act gives CMS and the whole healthcare delivery system many new tools, all pointing in the same direction.
There's not one solution to this problem. And so we have been working with a network of over 100 hospitals as part of our Aligning Forces for Quality initiative. And what we've found is that teams of healthcare professionals working together have been able to come up with plans that dramatically reduce rehospitalization.
It's going to take a combination of strategies, both best practices and financial penalties, to ensure that patients have seamless journeys from the hospital back into the community.
To me, the promise of working on care transitions is that as healthcare professionals, we'll get it right the first time. And that when someone comes into the hospital, they'll get better and go home and continue to get better. That's what we want to deliver as healthcare professionals, as a foundation, and as a healthcare delivery system.